Welcome to the AI Boost podcast. Today we are honored to have Ashley, CEO of Answers and Wise Therapy. So, Ashley, can you introduce yourself to the audience, please?
Yes, thank you so much for having me. My name is Ashley Buckner, and I am a licensed clinical social worker. I am currently licensed in 30 states, and I provide clinical supervision in all of those 30 states. I recently opened Anchor and Rise Therapy, and I'm just super excited for all the things that we are doing there. I currently hold a certificate as an MCAP, Master Certified Addiction Professional in Florida, as well as an ICADC, so an International Drug and Alcohol Counselor. I hold a NASW certificate in gerontology and also a certified end-of-life doula. So I enjoy a lot of things, and I'm also certified in accelerated resolution therapy, which is a big passion of mine. So my focus is just working with some clients and doing some great trauma work with them, also contracting, doing some clinical oversight for different companies, and providing clinical supervision to our up-and-coming social workers. So I'm very excited about that. So thank you for having me.
That's amazing. You are welcome. So, you have worked across so many settings: public mental health, CPS, and medical social work. So, what initially drew you into the mental health field, and what has kept you committed to this work for over 15 years?
Yes, so I was raised in a small town. I raised my daughter in a small town. And what I discovered was that not only was mental health not talked about, but it was definitely not addressed. The resources were not there. And so it became my mission to really help others in that space. I just found that so many people struggle, and I don't want people to struggle alone. I went to Savannah State University for my undergraduate and graduate degree. And I just loved the program. I loved being able to work with people from all different backgrounds and really be able to make a difference. And it's kind of kept me committed. I see the problems still occurring. So we still need help out there, right? With all the things people are going through.
Wow, thanks for sharing. How did working across so many systems deepen your understanding of trauma?
When I started my career, I was again in the small town that I raised my daughter in, and again, very few resources. And trauma occurs for so many reasons. It could be systemic, it could be generational, it can be from our childhood, different relationships and situations that occur. Trauma is all around us, and it impacts every part of our life. So being able to work with people on managing the past helps them not only now, but in the future, and how they manage things. Also, even how they pass that along to other people and their interactions. So that is working in each one of those settings, I saw the same thing over and over of people just struggling with things that they couldn't manage. So that's my passion is to work with trauma and to really help people in that space.
That's very inspiring. You specialize in trauma and addiction, two areas that are deeply interconnected. From your experience, what do people often misunderstand about trauma and how it shows up in behaviors, addiction, or causes?
So one of the first things I find is that not only are there barriers in regards to having qualified professionals, but I also realize that there are barriers in people seeking help. So you may not want someone to know your story. We may not have the insurance or the ability to pay for those. So we're limited in that way. And I do think that sometimes people don't want to talk about their trauma because we always think someone else had it worse. So we really downplay the things that impact us in childhood or in relationships or throughout life. And we think, well, everybody goes through these. Maybe, but maybe not. And the way that we handle them individually does matter. There's such a stigma around trauma. There's such a stigma around addiction. And so being able to have a space that you can not only talk that out, work through it, but be able to heal is beautiful. So I think those are some of the barriers, and especially with telehealth, the ability to seek care wherever you want it is so important. We really want to provide care wherever the person is. So if there was a good thing about COVID, it was that people had access to care that was not just in their town. They had access to care across the country, which I think really matters when we talk about addiction and trauma.
Wow, that's impressive. So, how do you help clients feel safe and understood when they're in survival mode? What role does compassion play in effective treatment for you?
Yes, that's a great question. So, my favorite professor in Savannah State, he once said to me that you can have all the education that you want, but it's really the connection that you have with your people that make a difference. So, I've always stood by that you go in with a sense of cultural humility. Don't assume that you know just because someone's from a certain place or they look a certain way that you know their story. Every person's different. So really being open to hearing what people have to say, being open to hearing what they need is a major part of healing. And so really letting them know that not only are there legal obligations and ethical obligations for you to keep their information private, but also just a genuine care. People can tell if you care or not. So coming at them with just an open mind and an open heart, and just allowing them the space to have what they need to heal in whatever way they need it is where change happens. Yes, so one of the biggest challenges I think is finding supervisors. It is very important that when you are investing in clinical supervision, not only financially but also time-wise, that you are getting someone that aligns with your values. We don't want to see a provider that doesn't align with our values the same way we don't want to see a supervisor. These are people that are helping you grow personally and professionally. So finding someone that aligns with you is very important. One of the barriers that I see is not only that, but it is difficult for people to have that access. Again, my small town, we didn't have very many clinical supervisors. So you kind of had to choose with what you had. And thankfully, I had wonderful supervisors, but that's not the case for everyone. So the ability to use telehealth has definitely helped us. Some states require in-person. So that is difficult. Is very important when you are working with not only clinicians that are coming up, but also clinicians that have been in the field for a while. So really making sure that they know that you're there for them, that you have their best interest at heart, to be able to be knowledgeable, but also to be open to learning new things, because supervision is a two-way learning. So making sure that you are setting expectations for them that are reasonable. I think so many social workers are working 2, 3, 4, 5 jobs. And so to say, we got to take care of ourselves is really important. So practicing what you preach, knowing the guidelines, having a safe and open space, and being curious about who people are and what they need is very important.
How do you think other organizations like your organization can benefit from the work you are doing right now?
Yes, so we know that clinical supervision is a requirement of the boards for licensure. And so just on a systematic level, we know that is important. So making sure that we're following the regulations, that's a big thing. But I work with companies that they need help growing their clinicians. They may not have had a space to be able to ask questions and to have that clinical oversight. So really being able to just reach out to people, reach out to companies, and being able to say, hey, what is it that you need? How can I best help you? Really being in that space of just being available. And the 30 licensures that I do have allows me to not only be available in my current town, but across the country. And that matters. A lot of times we even have the barrier of not being able to tell our local supervisor how we're feeling. There may be a conflict of interest there. So to have someone outside that can say, hey, we can talk about this, can be really impactful for someone personally and professionally.
Business.
So one of the big challenges is just making sure that people know that you exist and that help is out there. And I will say this, I say this to all of my supervisees, to all of my companies, to all of my clients. I want you to find the best fit for you. My company is all about anchoring in your strength, rising in your purpose, right? We want to make sure people know that they have options. So we don't want people to feel like they're the only option. We just want to get it out there that there's a whole lot of people that can help you. I want you to choose what works best for you. Trauma, addiction, mental health, they take our power away. So this is a space I want people to have power. So making sure that I'm collaborating with other people to say, hey, if this person feels that I'm not a fit, can they try you? To make sure you have other resources to offer people. So that is one of the challenges, is kind of getting your name out there, making sure that other people can link with you, so you can do those referrals, giving people the options they need. So that's a big challenge when you cover a large portion of the country, is just letting people know what's there. So accessibility to services, I do think, is still an issue. Even though everyone has a smartphone, it's not, people don't always have the private space to be able to have sessions. So really making sure that we are giving them options. For example, the VA has a tablet that they give their clients to be able to do telehealth. There are other organizations in the private sector that do that as well. So really having that access to care. My goal in the next 2 to 3 years is to partner with not only other people that provide this care, but doing grants and working with companies that will provide tablets, for example, that will provide free trauma sessions, especially with accelerated resolution therapy. I've reached out to a couple people this week just saying, hey, is there any free sessions you would like me to provide for some of your clients? Just because people need help, and some of these people for many reasons can't get it. So that is the challenge, is to get the word out there for a lot of reasons. But my goal is to collaborate and really network within my community and within my states that I'm licensed in to get people the help they need.
Wow. But how do you think AI can benefit therapy or session or the kind of work you are doing right now?
One of the big things that I see with AI is that I think it could be helpful in allowing the client to kind of go back and process what's happening. So we know that there are many electronic health records that utilize AI, and that it's a secure AI, and they're able to write their notes. The less time we spend on notes, the more time we spend for care. We know that happens. But also from a client perspective, to be able to have maybe an outline of what we worked on, or to be able to have resources that are generated based on our conversation. So if they're struggling with depression, or maybe if they're struggling with addiction, different modalities that they can use, or treatments that they can use, or resources to be able to help them. So your session doesn't just end at your session. Their healing continues even after. So right now, the main focus is people that need to work on their trauma or addiction. Really love accelerated resolution therapy, and it has become such a passion of mine personally and professionally. So I think that everyone could benefit from that therapy. So that is one population. I also think that whether it be clinicians that are up and coming in their education and their career, to have that clinical supervision, or even clinicians that are seasoned and just need an ear to listen, because I think once we've been in the field for a while, we feel we can't ask for help. And so to have that safe space to be able to help each other out is wonderful. And finally, I think that companies can benefit, because I do write a lot of policies and procedures, do educations and trainings for people, provide support on a clinical level. I just want to make sure that the next generation of people and businesses and professionals is well supported and cared for. So that's what we do here at Anchor and Rise.
One last question for clinician leaders or even individual listening today. What one piece of advice you had offered about resilience, boundaries, or sustainable healing? So what kind of advice you can give them today?
I want to say, as my grandmother used to tell me, practice what you preach. So it is very important that we understand that this is a profession that's not only it's not only taking our physical time, but it's taking our emotional space too. And in order to provide the best care to people that you are working with, you have to be healthy. We always hear, that you should put on your own oxygen mask before you help others. But that is actually true. And our supervisees, our companies, our clients know if we're telling them that and not doing it ourselves. It's on our face. It's in the way that we present. It's in the way that we walk in a room. So making sure that you know what's sustainable, and knowing that we are working with people on whatever level we're working with them. They are still people, and they deserve all of us that we can give in that moment. But we need to save some for ourselves too. So making sure that we are taking care of ourselves and our families and our passions is very important. That's what I would tell anyone every day.
Ashley, this has been such a powerful and grounding conversation. Thank you for everything you do to support our clients, clinicians, and communities. You're
Thank
doing
you so much.
a great job. So, if someone would like to get in touch with you or connect with you, how can they reach out to you? Where?
Yes, absolutely. So you can check out my website at www.anchor.and.rise, spell out and rise, rise.net. I'm also on LinkedIn as Ashley Buckner, and also my email is ashleybucknerlcsw@gmail.com. Also, my phone number is 727-3503, and all of that is for Anchor and Rise Therapy. And I look forward to helping anyone or just being able to chat about next steps or where I can best direct you. So thank you so much.
Sounds good. Thank you for sharing your information, Ashley. So, would you like to reconnect again next year? Maybe we can talk about how we can reach out to more people, because I feel like more people need to hear about what the good work you're doing in your community. So, when are you gonna be available next year?
I plan on Anchor and Rise being around for a very long time, so I am available and would absolutely welcome the time for us to chat. That would be great.
Sounds good. I will send you my calendar. That way you can schedule our next meeting.
That
so it was nice having you. Thank you so much.
Thank you so much for this. I appreciate it.
You're welcome. Bye.